Good afternoon, everybody. We're live here at on Blue Table Talk, and I'm kind of hearing a little feedback, Verly. Kind of turn your mic down a little bit, just a tad bit. So anyway, tonight we have a interesting topic. As everybody knows, this is Sickle Cell Month, and we'll have two guests on talking, speaking to us on sickle cell. So before I introduce either one of them, we just have one right now. The other one is trying to get in. Let's do our little housekeeping and talk about COVID. You know that we're expecting everyone to get vaccinated. I see that they're trying to get the 4-year-old, really the 2-year-olds on up to be vaccinated for school and everything, because we need our children in school and we don't need them to get sick and not be able to return back to school. So whenever the vaccination comes out for the 2-year-old or whatever, they need to go ahead and take it and trust our scientists, Pfizer, Moderna, Johnson. Trust them that they know what they're doing. I remember when I was a little girl and I was vaccinated. We had to be vaccinated when we were 6 years old to enter into school, and if didn't have our vaccination, then we couldn't enter into school. So now it's the same thing going on, that you have to be vaccinated. You need to be vaccinated. So whenever they start with the schooling system, then do what you need to do to get vaccinated. As far as the adults, you know that we still have people dying from not having the vaccine. But let's use our sense and 5 cents, because God gave us 5 of them. Let's use our sense and go ahead and get vaccinated, because it seems that it's happened. Even though if you do acquire COVID while you're vaccinated, then it won't be as bad as it is if you weren't vaccinated. So let's do what we need to do. They have, like I said, they have the Pfizer out, they have the Moderna out, and they have Johnson & Johnson. You can go anywhere around Beaumont and see the signs that says testing. And when they say testing, that doesn't mean vaccination. Testing for COVID. So if you get tested for COVID, then there's an infusion center on I-10 where you can go there and get infused so that you can have the antibodies. This is what I'm talking about, the antibodies, where you won't get sick. If you get sick, it won't be as bad. But like that, but get vaccinated, and then you won't have to worry about it. Well, tonight, guys, I am so proud, peacock proud, and honeymoon happy to have a girlfriend of mine on tonight, and which is Verdi Thomas McDaniel, and she's also one of my classmates. Also, and so I'm expecting. And I'm also expecting Nazia to come on tonight, but she's gonna get in a couple of minutes. So when she comes in, we'll just pull on in. Okay, so welcome, Verly May. How are you doing tonight?
Doing wonderful, and thank you for having me.
Great. Kind of introduce yourself a little bit before we go into our subject.
First of all, I'm a proud 1970 Bulldog fan.
Yeah.
Hey, I'm married to a wonderful man by the name of Stuart McDaniel. I'm a member of New Pilgrim Missionary Baptist Church. I'm active within my community. I enjoy cooking and basically a lot of arts and craft, and fishing is my number one sport.
She definitely enjoy cooking. I go to her house sometime and eat some of her food. So
You missed the good one Sunday.
enjoy cooking. So we have watching us tonight. We have Shirley Blanc and we have Beulah Norman. So they're here. They're gonna watch. And guys, let's ask questions about this. Is like I said, this is Sickle Cell Month, and we're trying to be very knowledgeable about it, because to be honest with you, you hear about it. I heard about sickle cell, but I've never had I had any. I don't have any that. I don't have that disease. I had never experienced it. But I've had. I was married to a man whose sisters had sickle cell. They were full blown sickle cell, and their children had it. So and I watched them go through a couple of crises. But to have it myself, no, I never had it. But Vernon May, tell us about sickle cell. Give me some information about sickle. What is sickle cell to you?
First of all, sickle cell is a blood order disease where your body is not producing enough healthy blood cells. Normal blood cells lives about 120 days before they're discarded and new ones are replacing those. With sickle cell, on the other hand, their like lifespan is only like 10 to 20 days, which means you have a low count. Which and those blood cells are here's the name sickle. They're sickle shape or moon shape, and they have a tendency to gather in smaller vessels, and they begin causes blockage. And wherever that blockage is, that's where the pain comes, hence the word sickle cell crisis.
Mm-hmm.
My first encounter with sickle cell, I didn't have the name of it. I was only in the fifth grade. I was just told that there was a blood disease that only affected black people. Well, black people, and that concerned me even at that age because somehow I knew this was going to be a part of my life. And true to form, it was. Both of my girls, my oldest daughter was born in June 19th, 1973. She was diagnosed when she was shortly past the age of 2. When we get married, they would give us blood tests, but they were only checking for a venereal disease, sexual transmitted disease. But they never checked us for sickle cell. So after being married and decided to have my first child, I was approximately 5 months pregnant when I heard the name sickle cell for the first time, the actual name of the disease that scared me so bad when I was in the fifth grade. They were testing in the school district, and my sister wanted to bring me. But I was too far along in my pregnancy at that point in time, and I just didn't want to know. Parents, mothers especially, you know your child from the time they enter this world. I knew something was wrong. I was constantly in the ER, constantly at the doctor's office. They accused me of having new mother syndrome, but I knew that wasn't it. Something was wrong.
Mm-hmm.
It was only after the age of 2 that they finally found out when she was limp. Her blood count was extremely low. She was pale, listless, just a lump of flesh before they diagnosed her. On the other hand, when I had this second daughter in November the 1st, 1977, she was diagnosed at birth. Time brought about a lot of changes because normally a child was not diagnosed until around about the age of 2. But now they're doing screening at birth. And so my thing was when I spoke with the doctor with the first one, how did she get this? We don't have it. I had the traits. Their daddy, Ambrose Nixon, had the traits. And together we created children with a full blown disease.
So,
That's why.
so you tell me that by you having a trait, you gave it to your children, and they had full blown. They didn't have the trait; they were full blown.
They were full blown. Uh, Before I had the second child, I did not seek a genetic doctor. At the time, I was totally unaware. Well, that didn't come up till later in life. That a genetic doctor would have helped me from preventing from having the second child with the disease because there were some things that was open that I didn't know about. Knowledge of sickle cell was so limited at that time. And when I spoke to the doctor about concern about us wanting to have a second child, he said, odds are the second child may have traits at the most. And so we went on that theory and we decided to conceive another child. Unfortunately for us, this child had full blown disease. My youngest child lived to be approximately 2 years old. She passed away March 19th, 1980. The oldest child lived to be 24. She passed away April 1st, 1998. The oldest child, once she was diagnosed, they told me she would not live to see the age of 6. Then they told me later she would probably make it to 12.
Okay, so wait a minute, hold on. Okay, so you're saying that it's only a black man's disease. Is that what you're saying?
No, It's not only a black man's disease. And that is the problem. We have this misconception that it's predominated within the African American race, but it's anybody, even Caucasians, who were born in the southern part of Europe can have this disease. South Asians can have this disease. Hispanic can have this disease. Anybody from Middle Eastern countries can have this disease. And now that we're having biracial children, we run the risk of that disease even spreading broader.
So by them
So,
coming, so by them coming, mute, mute your mic. Mute your
okay.
mic.
Okay.
By them coming from the European countries, then they're coming to us with malaria, right? Because that's what they have in Europe, malaria. Does that cause sickle cell?
I'm sorry, by muting my mic, I didn't hear the question.
I said that by them coming from the European countries, Asia and Europe and all that, those countries, they have malaria out there. So is malaria part of sickle cell?
I haven't read anything that connected those two together. And I've done a lot of reading on sickle cell because once my child was diagnosed, my information about it was zero. Of course, we didn't have the benefit of the internet back then.
Right.
So I spent a lot of time in the library, contacting the Mayo Clinic, calling all across America, asking some people to send me any literature that you have. And this is where I learned about the disease. I needed to know what it was, what my child options were, what was her prospective lifespan, what could I do to prevent her from having more crises, was there any treatments for it? I was just in the dark, and I had nobody to talk to.
What's the difference between sickle cell trait and sickle cell disease?
Sickle cell traits is that you have a genetic thing within your blood. Your blood cells don't, you're producing more blood cells than a person that has the disease. It's the full-blown disease itself. But you have the genetic makeup of the possibility of the blood cells sickling. So when you put those two traits together, you increase the probability of the child having the complete genetic makeup to give them the full-blown disease.
So how can we get tested for sickle cell? Should everybody get tested for that, or because we are the African descendant, or what?
In my age group and younger, of course, we're past childbearing age, but people who are in childbearing age who have never been tested, before you conceive, you and your mate need to be checked to see if you have traits. And before you conceive, if you have traits, you need to sit down with a good genetic doctor and discuss your options and the things that are available to make sure that your child that you bring into the world is free from this dreaded disease. Because no mother and no father want to see their child holler and scream in pain and can't do a thing in the world for them. But not only that, it is the other effects of the disease that's so deadly. The things I've witnessed, I wouldn't want anybody to have to witness those things. And these children have to go through some extreme pain, not only from the disease itself, but from the treatment process. Having fluid extracted from your lungs while somebody hold you over, bent over, and somebody's in your back, extracting fluid with a long needle. That's painful. Having someone hold you while they put a needle in your wrist to check your oxygen level. That's painful. Having someone, and this is another thing, one of the treatments is frequent blood transfusions. That's one of the treatments. Uh, having to have blood drawn constantly, and when you do that constantly to within the same area, those blood vessels eventually collapse, and you have to go to new areas. And these are children. I'm an adult. I'm afraid of a needle. So you can only imagine the fear that they have of that needle. But the other recourse is if your child is having a frequent blood transfusion, sickle cell children, they install what is called a metaport, which makes it easily, is just a prick. And there's something, lidocaine and other, they can put to deaden that top skin and break the skin without them experiencing the pain. And for IVs, so so much progress. And the issue with having constant blood transfusion, you occur what is called iron overload, which creates another problem, which sends you to another issue of possibility of having too much iron that's flowing into your tissue of your body, which is something the doctor would discuss with you and tell you what medications that are available to help you to prevent you from having iron toxemia. I'm using that word. I don't know if that's the correct phrase for it or not. And back in the day, my daughter would have to wear a portable IVAC that administered medicine to keep her from having that problem. So it's a lot. I'm sorry, I'm not able to hear you.
Okay, so I'm to that to my viewers, while you're on here tonight, go ahead and hit your share button so that they can know that we have someone on here talking about sickle cell anemia, because this is Sickle Cell Anemia Month. And we need to know more about these diseases that we have, like lupus and sickle cell and any other disease. So that's why I bring people on like that on the podcast. Karen Gidry says, that's the same as being asymptomatic for COVID, but not actually having COVID, right?
What was the question?
I just that no, she says is that's the same as being asymptomatic for COVID, but not actually having COVID.
What's symptomatic to COVID? Sickle cell?
Yes, yes.
Okay. Yeah, traits is like having the symptoms.
Mm-hmm.
You're a carrier. Like
Right.
some people don't have COVID, but they're carriers.
The
A
carriers.
trait person with trait is a carrier without having the full blown disease.
Right. Right.
But
So
when you put those two dynamics together, those two traits together, you
you get
you're creating the disease.
yeah, you're creating disease. Then your children, if you have children, then they'll
If you
come out.
have children together, right?
What happens if you don't have children? Then the trait remains the trait, or what? And not full blown. It doesn't metastasize, or what?
No, once you have traits, you have traits. And a misconception is, which is not common, that people with traits do not have medical complications. They
Mm-hmm.
can have medical complications as well. And one of those is heat strokes. We can have those issues as well. Several problems. Matter of fact,
I was going to ask you about
we have kidney cysts, which is a buildup of water sacs on the kidneys, blood clots in the lungs, heat stroke, and damage to your spleen. And the spleen is very important because that's the area of the body, that's the thing that helps fight infections. And that's another thing for sickle cell is that they have to be constant. When you have sickle cell, you have an army of doctors. You have to have your hematologist. You need your infection doctor. You need your regular pediatrician. You have to also, and especially with males, they need a urologist because one of the things with sickle cell is in the male, they will get a long-term erections because of the blood vessels that's in the penis, and that is painful. So not only that, you have to have an ophthalmologist because there are blood vessels in the eye and there's blockage in the eyes, which can also impair your vision, if not leave you blinded. So you don't just see one doctor. You are seeing an army of doctors to cover just literally every aspect of your body.
because I was getting ready to ask you about the health problems that affect sickle cell anemia. What were some of the health issues, health diseases that you have?
Okay.
Mhm.
With this kidney failure,
Right.
you can have
But
kidney
that's
failure with
the same thing you
sickle
can
cell
have.
anemia.
That's the same thing you can have with any disease, of kidney failure. Like if you're diabetic, you can have kidney failure.
Kidney,
Right? You can have
well,
kidney failure if you're not a diabetic.
exactly. Kidney failure, ongoing respiratory problems, and the greatest one of them all, the risk of a stroke. That was my burden with my oldest daughter. Constant strokes, and that eventually is the one that led to her demise. By the time she was age 6, she had had two massive strokes. Both
Wow.
of them left her paralyzed from her neck on down. The first one, she regained complete mobility. The second one, not so. She had right side weakness. The last one was at the age of 22. That one left her blind,
Mhm.
speechless, and completely paralyzed.
So is that the side effect for everyone who has a full blown sickle cell or what?
I beg your pardon?
Is that the side effect for everybody who come in contact with sickle cell anemia or what?
These are the things that sickle cell can that you can have with the disease. Everybody don't have it. Let me make that perfectly clear. Everybody don't have all these things,
Okay.
but you run the risk of having some problems.
Okay.
Also, you have damage to the hip bones. My daughter needed a hip replacement because the bones of the hip bones, the socket was raggedy, jagged edges, which made it when we were rehabilitating her after the last stroke, the one that left her paralyzed, but she was not a candidate because of the sickle cell. And of course, I've also told you about the prolonged erection for the male.
Right.
And also, I told you about the damage to the blood vessels in the eye. Also, it increases your risk of depression, anxiety, and difficulty with mental tasks. It causes fatigue. It causes a lot. It limits your daily activities as well. Anything that's going to overexert you and cause you to uh, burn up more oxygen. And that's the thing. The more oxygen you burn up, the faster the red cells die and the more sickling you're going to get. So you have to be limited with that. Exercise and athletic abilities, exposure to high altitude. When my daughter had to fly, I always had to hydrate her, and she loved to stay in the air. You say go, she's already at the airport. I used to tell a girl, this plane gonna kill you yet. And she stayed in the air. But I would hydrate her, oxygen her, uh, constantly, daily. You have to get on your oxygen. You have to be ready for this flight. Get her ready. Made sure when she boarded the plane, she had plenty of liquids. I always, even though they told me she would not live past 6 or 12, I always prepared her for a long life. Well,
Hello.
hello.
Hello. Ma'am, I can't hear you.
We can't hear you.
Oh, you can't hear me. Um, can you hear me now?
Can you hear me now?
Yes, ma'am.
Because I had myself muted. I said we were waiting for you. So
Yes, ma'am.
I was talking to Bernie about some of the side effects of sickle cell, and
Yes, ma'am.
uh, guess my viewers, Nasia, did I say your name right?
Yes, ma'am. Nicia.
Nasia is full blown sickle cell.
Beautiful name.
Yes,
Mhm.
she can tell. She can tell us a little more about it right now because she's going through it right now.
Yes, ma'am.
And I
Right.
think that, if I'm not mistaken, we had a crisis lately, right?
Yes, ma'am.
Can you tell us a little bit about have a crisis during sickle cell?
It's a lot of pain, a lot of dehydration, not being able to walk, just certain parts of your body aching, and there's not a lot of, medical research or help to, help during those times.
Right. How old are you? If I
I'm 21.
21?
Yes, ma'am.
You're a
I
pretty
just,
lady. You're pretty.
yes, I just turned
Pretty young
21
lady.
on the 6th of September.
Okay. Okay. So, does anybody in your family have sickle cell besides you?
Yes, ma'am. My brother, he's 22.
So your parents are carrying the traits.
Yes, ma'am. They both have the trait.
Okay. So, and Miss Bird was just telling us about she had the traits. So her
Yeah.
children had sickle cell, full blown sickle cell.
Mhm.
So, sickle cell is. I mean, you hear about it, but a lot of people don't really know about it. I mean, we know
Yes.
you got sickle cell,
Mhm.
and now you're going through all this. You're going through all these pains and whatever. But it's almost really, and I had some a guest on here that had lupus, and it seems like it's almost like lupus. Is it?
Yes, yes.
Yes.
It's a blood disorder, so it kind of like is almost in the same category as what cancer and lupus would be because it is a blood disorder.
Leukemia.
Yes,
hmm
ma'am.
Oh wow, wow.
Miss
So
Naya, where most of your crisis occurs?
My back and my legs. And
Okay.
sometimes my chest when I'm having an acute crisis, but
hmm
it's rare, but just sometimes.
Okay.
right, how
God
often do you have
bless
a
you.
crisis?
Not very often, about 6 times a year, but sometimes I have it to where it's almost a crisis and I can catch it before. So sometimes I'll have a hospitalization because I'm experiencing those pains, just not the full blown as bad as it could be. So sometimes I'll be in the hospital for like just almost having, those issues. But yeah,
Yeah, right, right. And
Have you reached a point where they're giving you morphine?
yes, ma'am.
wow. Wow. I mean, you guys can, feed off of each other because, like I said, Verlin children had it. I don't know if she probably you weren't even born
She
with
wasn't
her children.
born.
No,
Mhm.
but I think your mom knows her children,
Yes,
and
ma'am.
so I know, but I know your parents. I know both your parents. So,
Yes,
and
ma'am.
I know that they have taken great care of you, and just like Verlin,
Mm,
Verlin has
yeah.
taken very great care of her children. But I want to ask a question: is there a cure for sickle cell disease?
There are things like the bone marrow transplant. There's not like really anything, not really.
Not really.
And even if there
Better
was,
treatment. Better
yes,
treatment
even
to
if there,
minimize your crisis, but nothing that you can pinpoint and say, "Oh, we can give you an injection." Bam, it's gone.
yes, exactly, yes. And
Nothing. Nothing like that yet.
I know a lot of sickle cell patients like me and my brother will get on Advenco and the powder, and it causes us to go into a crisis. Like soon as we get on it, I guess it does it to help us, or before it starts to work. But we don't like that because say like we stop taking it for a while and then we take the medication for some reason, like it does that to us. So I don't
Mhm.
know. It's just
So,
not a lot of
so is,
research.
so is there another medication they can give you guys?
Hydroxyurea,
hmm
penicillin. They used to give penicillin when we were little, but hydroxyurea for now.
So, Fred, did they give that to
hmm
your children?
Hydroxyurea.
Okay, okay. So it's that
hmm
that that medication has been out
Yes.
time.
Yes. Oh, yes.
Okay,
It's been around.
it's
Matter
been
of fact, that was one of your main treatments for pain.
Yes,
That
ma'am.
morphine, opioids, and
Yes, ma'am.
but your best treatment has always been when you feel the crisis coming on,
Mhm.
hydration and oxygen.
Yes, it's so hard to, because we're young. So, sometimes we don't do the right things that we know we should be
Exactly.
doing when it
Mm,
hits. We're like, because it'll happen in so fast. We'll be having
real quickly.
fun. Yes,
Real
getting
quickly.
out in the sun. We have to understand when to go back in the house, when it's too hot, when it's too cold. We're not, climate doesn't help. So,
No, it doesn't.
how old is your
mhm. Ma'am.
how old is your brother?
He's 22.
Okay, okay.
Yes, ma'am.
Oh wow, wow. My heart goes out to you guys.
Thank
Like I
you.
said, I'm not versed in sickle cell, but I am getting versed in it tonight.
Yes,
So,
ma'am.
but it's a disease that like I asked Verly earlier, was that only a black man? Because Verly, in the earlier years, they detected that was a black man disease. That's why I asked you that. Was it a black man
Uh,
disease?
It's found
because
in most.
basically, I'm sorry, baby. Go ahead.
It's found in most black people, but sometimes it's rare. But there are like other ethnicities, like Hispanics, or people with that type of bloodline who can also have it.
Right.
Hmm
Right. What you was getting ready to say?
Now, basically, what she said is prominent, more dominant in the black race,
Mhm.
but you can find it in other races as well. Actually, anybody from around the Mediterranean, who origin is from the Mediterranean area, you
Mhm.
will find Italians as well.
Yes.
But if you notice, it's mostly people with a tan
Mhm. Like
complexion,
melanin. Yes.
Really?
melatonin.
Yes, ma'am.
They're
Really?
the ones. They're
Wow.
the ones.
Brother, you mentioned earlier about exercise, and I was going to ask you that. I was going to ask both of you guys that question about exercising. What type of exercise can you guys do, and what are the limitations of exercise?
Go
Um.
ahead, Snatty.
Okay. I try to exercise as best as I can, but it's hard to know when you're over exhilarating your body too much, because you can like fall in love with exercising and do it too much and cause a crisis to come on. Now, my brother, he loves exercising. He keeps up with that a lot, but he gets sick a lot because of it. He doesn't know when to stop. So you have to have a point where you're not trying to make your body sore, because obviously normal people get sore with it, but you have to have a point where you're just not pushing yourself as much as another person would.
Right.
My
Right.
Mhm.
daughter wanted to run track when she was in the
Mm-hmm.
sixth grade. I said no. I prepared her for life. I wanted her to live life the best. Gave her, I didn't want to put too many limitations, but that was a no. And unbeknownst to me, her cousin, Coach Nixon, she told him, my mama said it's all right.
Oh
And I
my.
found So when he sent me the paper for my approval, she was already running. So I goes down to school and I'm hot. We talk. He said, I understand. I know her condition. And then he said, but she developed her athletic abilities from her daddy. The girl can run. I said, but she has paralysis. He said, it's a funny run, but she can run that ankle on that relay team. He said, we have a meet that Friday. So took off for work because I wanted to see this. And the girl can run. And
Just
I let her do a few, and she had a crisis, I think, after her third time. And I
yeah.
told her that's it. She wanted to take swimming lessons. You can take piano lessons, voice lessons, but we're not doing swimming, we're not doing gymnastics, we're not doing running, we're not doing those things.
Yes, you have to have like with me. I did want to join sports at first. I did do cheerleading for a little bit, and I had to find something that I liked where I can also feel included. So I was in choir, and I was also in band, and I played the flute. So that's where I kind of, but for my brother, it was a little bit harder for him because he's a man, he wanted to, play football. He still talks about that a lot, and he just hates, being limited. Yeah.
Right. Right.
And
Wow.
another thing, let's talk about the disciplinary problems with children with sickle cell. Because and I know you can bring on a crisis when you want to have your way. They
Mhm.
can actually make themselves sick.
Now, see, and I know that's not you, right?
No. No.
My
Maybe
rule
when I
of
was
thumb
younger.
was when you were younger, you did it.
Yeah.
My rule was I had an oxygen tank at my house.
Mhm.
I tell my daughter, set it on 3 liters, since it's timer for 15 minutes. When it go off, and I bring her a glass of water, something to drink. And when the timer goes off, I'm gonna take handle up my business. You're gonna set it back on 3. You're going to set the timer for 15. I'm gonna give you some water, but you're not getting away with a thing. But they could act, and how I found out, it was something she wanted to do.
Mhm.
And under her breath, she said, just for that, I'm gonna get sick today.
Oh my
I
gosh.
said, oh my God. So I spoke with our doctor about it. He said, oh, she can bring herself into one if she want one. I said, so she's been playing me. So I learned we're not having it. We're
Yeah,
not
because
gonna have
that's
it.
it's so easy to just not take care of yourself. Like, you know, not we have to drink more water than a normal person and do
Hmm.
certain things, you know, and take care of our bodies and eat certain things. And if you're not doing that, it's very easy to get
Hmm.
sick. So it is easy to get sick, even
Right,
on accident. So yeah.
right. But
And the
let me ask you a question, guys. How is the testing done to find out whether or not you have,
blood, blood,
huh?
simple blood test.
A blood
Mhm.
test?
Simple blood test.
Yes.
Seriously?
A simple blood test when we got marriage license in my day would have told me I had traits.
Mhm. A CBC, yes.
Yeah.
Mhm.
Simple
Um,
blood test.
Yeah.
And another thing about sickle cell, I ask you why were you were having most of your crisis for a reason. My daughter had most of hers in her abdomen, her stomach area.
Yes.
It masked other things that was going on that we weren't aware of
Mhm.
because we were all counting them as crisis.
mm-hmm,
Yes.
And and one of the problems you sickle cellers have is gallstone problems.
mm-hmm.
Mhm.
And she was having gallstone and appendicitis, but we didn't know it because we were saying crisis. She was always treated as a crisis until it got to the point that it was bad. Her appendix was about to rupture. The gallstone had gone up into the ductwork,
Yes.
but because it was hiding something else.
That happened to my brother. When he has crises, it's really bad for him because he also has acute chest almost every time he has a crisis, and he has abdominal pain all the time. And we would just think, um,
Stomach
that
ache.
he has a normal stomach ache. But as he got older, about 2 years ago, they said it was his appendix that was like,
Hmm.
but we also don't have good hospitals out here in Beaumont. So they kind of just say anything once you get to the ER. But
Right.
yeah. Hmm.
Yes.
Okay, so with that being said, could you guys have surgery like take your gallbladder out or take your appendix out? Can you?
Yes.
Yes.
As a child, the first thing they did was take my gallbladder out. I was about 8 or 9.
Gallbladder, appendix, spleen,
Mhm. And your tonsils.
Now,
tonsils.
I thought that if you take your spleen out, because that the spleens, stop all kind of
It's
infection.
for right.
Right. So,
But
but
it,
go
even
ahead.
if they don't remove it, it mortifies and die. They didn't
Mhm.
remove my daughter's. Hers just died.
Mhm.
Really?
Yeah.
Okay. So, Nasia, do you find yourself tired all the time?
Not all the time, but mostly. Mostly. Like I can just be out in the heat. The heat has really been affecting me and my brother, and I just get really tired, like fatigue really bad. So, yes.
Right. What about your children, Verly? Did they get tired all the time?
The youngest one, no, that girl could go for hours.
She was a
I
Verly
wish
Jew.
she would just, I wish that one would have settled down a little bit. The oldest one was not very active at all.
Right.
Mhm.
Not very active at all. She was very, very low key, and she took long naps.
Mhm.
But the youngest one, she was in her terrible twos when she left,
Mhm.
and she kept us on the go. When she was born, and the night before she passed, her dad and I were sitting down talking. I said, "You notice the difference that Keisha has made in our life?" He said, "Our house was so quiet, so still." He said, "But now she just done turned it upside down." I
Mm-hmm.
said, "What a difference. We didn't know she was leaving."
So
But
let's see what type of pain does it causes? Is it excruciating pain or just mild pain?
It can be in between. I noticed, like how I was saying, when it's not a full blown crisis, but it's almost there, it's mild. But if it's full blown and all of my blood tests are coming back and all of the numbers are just horrible, then it's full blown and it's excruciating.
Right. So
Mhm.
can you feel it coming on or what?
Yes, ma'am.
Wow.
I'll notice certain things, or I'll be too tired, or have a really bad attitude, and
mm,
yeah,
yes, Lord, they can have a bad attitude.
uh-huh.
And you have to have the
Wow.
patience of Job to deal with them because they're hurting.
They're hurting.
And and as a parent, you don't want to see them suffer, but it's nothing you can do. And they lash out at you, so you let it go. You walk away because
Really.
you understand that they're hurt. And here's the thing: sometimes a crisis can start off real bad.
Mhm.
It may not last but for a few hours.
Yes.
It could
Mhm.
start off real mild, and you can spend 2 weeks in the hospital.
So
Mhm.
as soon as you have a crisis, you have to go to the hospital or what?
You can try to catch it. It probably would be smarter to go in the hospital, but some of
But you
us
try to
like,
catch it.
yes. Mhm.
You
Wow.
try to catch it because number one, your child don't want to keep running up there. Because and
Right.
Mhm.
that's what I'm
You
saying.
don't. Yeah.
Sometimes it can start off real bad, and if you have like the oxygen and the oxygen is really a biggie. And I kept a full oxygen tank at my house, and so I put on oxygen and start forcing the fluid and giving her pain medication. And sometimes that's all it took. A
Mhm.
few hours later, she's all right. Sometimes it start off mild. I start that process, but before in a few hours, I know I got to move now. It's
Right.
time to go.
Right.
My child has actually been walking across the floor and just fell. And I go run over to see what's wrong. She's sound asleep. I mean, dead sleep.
Right.
I said,
Right.
it was some weird. And she comes to me one day. She say, "Mama," I say, "What, baby?" "My eyelashes hurt." I say, "Shannon, now you exaggerating." And she said, "No, they hurt." I said, "Let Mama see." All fluffy. So I took her to the doctor. He said, "There are blood vessels. They clot. There's blockage there. Of course they hurt." Have your eyelashes hurt? I see you have beautiful eyelashes.
Thank you. No, ma'am. That's something I just learned just now. But I noticed, certain things like that, certain parts of your body, you wouldn't think that a sickle cell crisis would come in then, or something would be wrong. My brother has a bad eyesight, and he had to learn. The Beaumont doctors out here were saying a whole other thing about his eye. But we went to Texas Children's, and he was having like a full blown crisis in his eye. So yeah.
Yes.
I'm glad you brought your brother up because I want to ask you, what's the difference between a male crisis and a female crisis? I mean,
He it's like a man who has a cold and he's just over exaggerating. But I don't think he's over exaggerating, but he will be screaming his pain. He feels it heavily. He can't walk. He'll scream. So that's kind of the difference. I feel like in most females, we know how to be calm a little bit about it, or kind of breathe in on our pain. We know how to handle that. But him, he just goes straight to crying and stuff. But certain
I
things,
know.
he has priapism when he has sickle cell pain sometimes. So that kind of factors in.
That yes,
wow. So what can a person do to help?
that's painful.
Um,
Basically nothing, huh?
We've had the opportunity to be in the hospital with Anthony when he had a crisis. And my God, he used to turn pediatrics out. And sometimes the nurse would be in our room and they say, Anthony's on his way. They say, "Oh my God, I wish I could take a day of vacation to get ready for him." Because when the guys would come in, They gave the nurses a hard time.
Mm-hmm.
Right.
Yes,
Anthony, you could hear him from one end of the hall to the other.
Right.
yes. I noticed that a lot, and they can't be still. That when they experience their pain, it's just like there's nothing you can tell them. They won't even breathe because that's how much they're feeling their pain really badly. And it is bad because not a lot of them know how to speak for themselves when they're in pain. They're just crying, and you don't have doctors who understand. So a lot of women can, kind of tell a doctor what's going on and explain more in detail. But my brother or like other men I noticed with it, it's harder. You can hear them screaming from the other side of the hall. It's a whole thing, and it is harder for the nurses because they have to be on track with your pain medication, with your fluids, talking to the doctors, telling them what you can't tell them. So it's a lot for the men like that.
So if when you go into the hospital, do you go hospital out here or do you have to go out of town, like Galveston or Houston or somewhere like that?
I used to go to Texas Children's, but they broke up with me. I turned 21. So that's what I called it because I was so hurt because I've been going there since I was a child. So I was so hurt. But
I feel your pain.
yes. But I go to Baptist Hospital.
Okay, so they're fully equipped on your cases.
No. That's
No.
what's so bad about Baptists. You get a hematologist doctor, and they're more informed about because it is a blood disorder. Hematology is also cancer, so they're more experienced with working with cancer patients than with sickle cell. And I mean, the doctors out here are just not
Dumbfounded.
understanding. Yes,
Dumbfounded.
you're teaching
And
them, and sometimes
exactly.
they don't even like that. They don't like that you're telling them something that they don't even know, and it'll make the experience worse for you because they feel all matter of factly about it. So
But still,
My daughter was an adult and still with her pediatrician because we couldn't find a doctor.
I was
yes,
going to say still. That's why I said that it was a black man's deal because you can ask some black doctors and they can help you out more than any
No,
other. No.
no, no.
and sadly,
That's the biggest
sometimes it's
mistake
worse.
I ever made in my life.
Yes, sometimes
When
it is
I
worse.
left Dr. Bobby Colbert, and the only reason why he cut her loose, because like I said, she was an adult. And
Hmm.
when he wasn't on call, there was nobody to see her because she was not a PD patient. So I had to find me a doctor. I went to a Caucasian doctor, and he point blank told me, I have no knowledge. He said, but if Dr. Colbert would work with me, he worked with this doctor, and this doctor was so cautious with my child that he would put me in the hospital. She said she had a hangnail. He wore me down. He wore me out. So then I went to a black doctor. Worst mistake I ever made in my life.
They, it's sad, but some black nurses and some black doctors, you think you're receiving help, but it's also that our people don't understand anyways.
They
When
don't understand.
they don't, that I have a black nurse tell me, "Oh, I've heard about it, but you're my first patient." Well, you know how my night's gonna go because of that. So
Okay,
yeah.
okay.
Hmm.
And when I
Nasaya,
went to the
Nasaya,
black doctor,
I bet you cut up in that hospital.
she cuts up. When I went to the black doctor, I told him why I was coming to him, and Dr. Colbert would work along with him. He said, I'm a doctor, I don't need him. That was my first clue. I should have ran in. But I said, no, he's going to be more informed. The best hematologist I had was not black. And he was in Galveston, Dr. Dashner. He was over the hematology department at John Seeley in Galveston, and he was doing sickle cell research. This man would call me on the regular and let me know everything that was going on. And I Shannon got in his program. He was the best hematologist I had. I had no hematologist here in Beaumont.
Yeah. I do not. I can't wait to get a better care because out here in Beaumont, when I go to Baptist, it's either I have a bad nurse or a bad doctor, or I have a good nurse or a good nurse and a bad doctor. It's like that almost every day. I have a nurse who understands, and then what's so bad about it is You have a primary and you have a consultant. Guess who's the consultant? Your hematologist. So they have no say. They have no say. The primary sometimes feels like they're a know-it-all, and they don't even treat sickle cell. They treat anyone. So
Right.
the primary can discharge you whenever they want to. They feel
Mm.
like you're not sick. Your hematologist has no say whatsoever. Whatsoever.
But when my daughter had the last stroke, and the one that paralyzed and eventually taken her life out, this happened December the 2nd. And about at mid-December, before Christmas, they wanted me to leave because they said the insurance company wasn't going to pay anymore. My thing is, I'm in here. It's your job to get me out,
Mm-hmm.
and it's not going to be easy.
Mm-hmm.
So my doctor comes in and he say, "Well, the insurance say they're not going to pay anymore." I say, "Well, that's their right not to pay. As long as I'm paying, they're going to pay." I said, "We'll deal with this when we leave." He said, "Well, I'm going to discharge." I said, "You can sign any papers you want, but it's going to take an act of Congress to get me out of here." And I said, "And before I leave, I have nothing to lose. My child is going to go home and die, so I'm taking a whole lot of people with me. Is that a threat?" I said, "Call it what you want. I'm in here. Your job is to get me out." So I called the administrator of the hospital. He and I got on the phone. He said, "Oh, I've been knowing about that. I knew before he knew." He said, "But you all been coming here for the longest." He said, "And as long as he doesn't discharge her," he said, "I didn't bother you with that." He said, "That's my job to get the money from the insurance company." I'm glad I didn't leave. My child spiked a temp of 105. Remember I told you about the Metaport, Twiggy? Do you have a Metaport?
No, ma'am.
Her Metaport got infected.
Mm.
They had to rush her to surgery to remove the thing. They couldn't get it out. The tip stayed. They did a culture. The tip was infected. That's where the infection lied. In order
Wow.
to remove, they had to open up her chest cavity like she was having open heart surgery to remove it. She didn't have the strength nor the ability to sustain that type of surgery. So they used a heart doctor to use heart catheters. He met with me. He said, "I'm only going to try 7 times." She was in there for over 2 hours. The surgeon kept coming backwards and forth and giving me reports. He said, "My God," he said, "there are hundreds of catheters on the floor. He will not give up." When Dr. Margolis came out of there, he was soaking wet from the top of his head to his feet. His clothes was, he said, "I wanted to stop, but when I saw how frail she was, I refused to give up. I got it." If I had listened to that doctor, her doctor, and left that hospital, we'd have never made it back to the hospital.
Right.
So you
Let,
have to you have to have a strong backbone.
right, right. Let me go to the viewers and let's see what they're saying to you guys. Ida Wright says she's a strong young lady and her brother. God continue to bless her and her brother.
Yes.
Willa Lightfoot says keep your faith and courage. Uh, guess who this is? Denise Brown says I'm so proud of my baby. And
And
so,
mama.
right, that's my baby. And so let's see what else they said. Cheryl LeBlanc says, "I'm glad we are here listening." Oh, okay. So she wanted your mama to chime in, and so she says you're doing fine. And so Latoya says, "Is that Kitty's mom?" Yes, that's Kitty's mom.
Mm-hmm.
Um, Latoya also, oh, Captain Wingate says that's why you need to go to Houston. They will give you great care. And so Latoya also said, watch him from South Carolina. Okay. Denise said, Captain Wingate,
Yes.
with the COVID, it's been so hard to get into a new hemo. Doctor, my son goes to UT physicians. Okay. So great comments and everything. But let me ask you another question. Do you get stressed out? And if so, how do you manage it?
I get so stressed out because these people, I try to tell my brother, do not let them see you angry. Try to talk through it because you will get so stressed out trying to teach them how to treat you or telling them that they're treating you bad, or you get stressed out before you even go because you're like, gosh, I already know I'm in for it. You get stressed out trying to call doctors to see who will take you under their care, or trying to see who my nurse is for tonight, because I know this nurse is not going to work out. Like certain things like that, it's stress is just written all over it. Sometimes I get stressed out for not telling my mom what's actually going on, because I know she's going to be on that phone telling them what are you doing? What are you doing wrong?
Right.
So
Yeah.
yes.
Yeah. I know your mom.
Yes,
I
ma'am.
must say, we had the best nursing service. We started at Women and Children.
Mhm.
Excellent nursing service. When they closed, we wound up at Baptist. Excellent nursing service. I had nurses that really knew how to take care of my baby. My only problem came, it was never with the nursing service at the hospital. It was always with a primary care doctor.
Mhm.
That
So
was
do
my
you?
problem.
What about you? Does your primary care doctor, is he abreast of everything? Or she abreast?
Um, I have a nurse practitioner who's under the primary care doctor, who is amazing. But last time I was in the hospital, unfortunately, I was switched over to another primary doctor, and he was fighting with me tooth and nail. He did not want to put me back under her care at all, and she was trying to talk to him because Dr. Paylon, the actual doctor, he had been away on vacation, so she couldn't do anything because she's just a nurse practitioner. He was
Right.
over everything, and he was telling me that she didn't want me. She was texting me and calling me, and my nurses was like, "I just talked to your nurse." She was calling me every day that I was under that man's care. It's just, yes, primary is horrible. There should never be a primary doctor for a sickle cell patient.
Right.
Always, that it's horrible. And then he told me, well, the nurse told me, once he leaves the hospital, he don't want them calling them. So
Right.
anything can happen under,
Right.
while he's gone, and he doesn't even care. He'll deal with it when he comes back at 12 p.m. the next day. So that's how it
Mhm.
is with them. Yes.
They
Wow.
question other doctors, like if your hematologist come in and order certain things, or say we're going to do something this way, or your infection doctor, they question it, and this person is making good decisions for you. And like I just told mine, look, the money that they gave you to go to college, you'd have been better off buying you a tuna fish sandwich because you didn't learn anything.
Oh my God.
So I want you to sit back, shut your mouth, and let these people do what they can do. He got mad and threw his prescription pad at me. I told him, look, at this point in life, my child is leaving me. I have nothing to lose. I said, you'd have messed with the wrong mama. I had to plant my foot flat on the floor and stand my ground and told him, all I need you to do is write the orders I call and tell you about what I want.
Mhm.
And that's when he threw the prescription pad at me. I said, because you don't know Jack.
Right.
And I
I
have
said,
a
I'm taking advice from all the other doctors that we're seeing. I'm seeing two different surgeons. I'm seeing neurologists. I'm seeing hematologists. I'm seeing infection doctors. They are doing the best that they know how for my child, and I can see the progress. You, you're going to get your money. That's all I want you to do. Just collect your money. But I don't want no input from you.
Right. Right.
None.
not-
No
when I
input.
when I
Just
was in
collect
Bap
your check and keep your mouth shut. That's all I want you to do.
when I was there the last time at Baptist, I was there for almost a month, I believe.
Mm-hmm.
And I came there with a really bad sickle cell crisis, really bad chest pain. I had to beg them to do a chest x-ray. I had to beg them to do everything for me until they finally relented. I had texted my nurse practitioner, Dawn, and told her I was coming up there so she can go ahead and switch me under her. So They ended up finding out that I had COVID and a urinary tract, and I was going through a sickle cell crisis. I had all three. And so, her being the amazing woman she is, she was like, okay, I'm going to switch you for your primary to a COVID doctor, and I'm going to let your consultant be hematology because I don't want anything to happen under my care. But by the time we talked the next time, she was like, I wish I would not have done that because there was nothing special they did. I could have gave you the same antibiotics, and she was calling every day, asking the nurses what were they doing. I had asked him, even hematology, for a breathing treatment. I could not get it because the COVID doctors were coming in so later on in the day that I felt like I was on my last leg. I really did. And there's nothing I could do. The nurses did not want to come in my room. So I wasn't eating. Whenever I would need my pain medication, I'd have to ask them to come in. It would take so long. They didn't want to come in my room at all, even with the right equipment that they had. So I was eating later on and just not getting my food. I would call the nurses station sometimes and be like, is dinner late? No, your nurse just didn't bring it. And I would get it cold. So that's how I was treated the whole time. And because I wasn't under the right care, I ended up getting pneumonia and a blood clot also. So that just added onto everything. And it was just horrible. Hmm.
So with that being said, what you said you had COVID. So were you able to get the COVID vaccine? Or did
Yes,
you?
ma'am.
You were able to take that.
Hmm.
Wow.
Hmm.
That's good. Wonderful, wonderful,
Right. Right. Yeah.
wonderful. I wish
I
you and
mean,
your brother the very best.
Thank
I'll give this
you.
guys the best. I'm praying for you guys, and um, when your mom always put it on Facebook that something is, you go through these crises and everything. I'm praying for you guys, but I knew you, but I didn't know your brother had it as well.
Yes, ma'am.
Uh,
He's sick right now. That's why he can't join. He's really sick right now. So,
Oh,
right,
okay.
right, yeah. So my
Message to
question,
mother.
yeah,
Stand your ground. Be mama. Don't let nobody push you around.
baby
Nobody carried her
Lord,
9 months and nobody went to labor for you. Stand your
mhm.
ground.
girl, you do not have to tell Denise that.
I,
She will.
I, I, I kind of figure she a woman just like me. I'm listening to her daughter.
Yeah,
I'm
right,
listening to her daughter, so I know what her mom is already like.
right. So anyway, what should you tell future parents who don't know that their children have this disease? What comment can you tell them?
Just please ask for a CBC, ask for to get the test. If you know that you at least have the trait, please just make sure, just to be certain, because if you don't know, you're not going to know how to help your child, and that's the worst pain that they could ever go through as a kid also, because they don't even understand. So just try to do everything you can, try to ask for the test, anything to learn about it. So
Right. Yeah. What would you tell
That'll
them?
be my response as well.
Right.
Young couples, before you conceive, please be checked. Make
Mm-hmm.
sure you don't have the traits. Make sure you have the traits. Go to a good genetic doctor.
Right. Right. Kathy Wingate says she's praying for you guys, and she lost a great nephew at the age of 5 years old to
That kind
sickle
of
cell.
pain.
so
Yeah.
sorry.
Yeah. So, like I said, we're praying for you. I wish we can go on and on. This is an hour-length show, but I'm gonna have to bring you guys back on before the month. We only have one more Tuesday,
Yes,
but it
I'm open.
doesn't even matter because we, like I said, if you don't know, you're ignorant to the fact that stuff that you don't know, and you need to be educated on diseases like this. Like I said, I had somebody on for lupus. Now I have sickle cell. I'm gonna have somebody for cancer, diabetes. As the months come on, whatever month they're celebrating on that month, I would have that somebody on for that. But as far as sickle cell, we're done falling into that. We don't know. A lot of people don't know
I
what's
don't want people to fall into this trap too, because you know what? We had a friend. He did not realize he had sickle cell until he got into flight school. He was in the military. And he did not know he had sickle cell until he started to fly a plane.
wow. Okay, so the clock on the wall says it's time for us to get out. But before we leave, I have an announcement to make. We have a smoked turkey legs and boudin to benefit elect Carolyn Guidry for county judge. She's running for county judge. And it
All
will be
right.
Saturday, September 25th, 2021, from 10 till
All
4.
right.
Pick up drive through is 3849 Memorial Drive in Port Arthur, Texas. You can pre-sale your order or you can cash app it at $descendant or 409-767. Let me see, hold on. 767. I have it going across the screen at
Good.
767-3355. You can call that number, or you can cash after her. So let's have Callan Gidger. She's running for county judge, and so we can get her in office.
Let's
Okay,
do
so
what we do.
what would you like to say before we get off the air? Anybody would like to say anything before we get off?
Just get checked. Learn
Yes.
as much as you can about this disease.
Mhm.
You may be out of the age range for childbearing, but be knowledgeable because you don't know where in your family it may hit, and you may have to educate that parent.
Right, right,
And I
right,
just want to say I'm so open to have this conversation again because you can learn so much from us just talking about this. So
right.
just let me know even next year or something. I'm so open to it.
It's not going to be next year. It's going to be sooner than that. You know,
Yes,
because
ma'am.
Unlike,
because no, and
unlike you, baby,
I will be
I
contacting
disconnected
your mom
myself from
and
the
you.
disease.
I will be contacting your mother and you and tell Terry.
Yeah, her and her mother needs to be on when her brother is well.
Yeah, you and your brother.
Yes,
You know,
ma'am.
even your mama, even your
Because
mama. Come on.
I've truly disconnected myself from the disease. After my daughter passed, I didn't want to hear any more about it. No more. And I just
But you can help
disconnected
somebody.
myself.
But you can help somebody. You know what I'm
I
saying?
only say something about it when I know somebody is just starting to face it and they
Mm-hmm.
ask me, then I share. But to just be open to talk about it, I don't because it opens up too many wounds for me.
Right. And I was very reluctant in asking you. I had to pray on it to ask you, should I ask her or what? So I just called you and she so proudly said, yes, I'll do it. I mean, didn't hesitate, didn't do it, she'll do it. I call your mom, Nasia, and I text her and asked her because I thought Denise had it for and if she said it was, you guys. And so she said she would be more than happy to tell you about it and see if you come on. And I want to thank you for accepting the
Well done, young lady. Well done.
Thank
invitation.
you.
Nobody can tell it like the person that's going through it. And
Yes,
baby, you
ma'am.
told your story very well.
Thank you.
And people are on here saying it's very informative. And thank you so much for coming on. And like I said, I will be calling you guys back. And now, to my audience, if I can help somebody as I pass along this way, then I know that my living is not in vain. God bless you and God keep you. It's my prayer. You guys stay on. And I want to salute to you. Don't forget about the smoked turkey legs on Saturday in Port Arthur and boudin. Boudin $5, turkey legs $10, and they're gonna be
I
delicious.
want
So
turkey
we need to
legs.
support Callan Guidry as she runs for county judge. God bless you. God keep you is my prayer. Smooches.
Thank you.